There's a couple of different talks that I will be delivering at this meeting. In one, I'm emphasizing the use of advanced software for practices as they evolve into a busy radiosurgery practice in tracking longitudinal patient outcomes, improving patient outcomes by critical analysis of data and imaging analysis, as well as the ability to use AI tools to detect tumors automatically, simplifying the process of both identifying new disease as well as treating patients whose disease is already known to us. And we have shown that there is a very high accuracy with the artificial intelligence software to the extent of about 98%. In fact, in some cases, it was able to identify tumors that the human user had actually missed. So I see it has a great future in the management of metastatic brain disease. The other talk will focus on the specific application of radiosurgery in patients with meningiomas that have been surgically removed, which pose unique challenges and based on histology might prove challenges to dosing and fractionation. So most of us have been ISRS members for a while and also have been members of other radiosurgery societies. I think the ISRS, or radiosurgery as a whole body, becomes fairly complicated since it involves all organ systems. And CNS, being the original site for radiosurgery, in some ways deserves a summit because the unique nature of CNS radiosurgery practice distinguishes it from other subsites. And the fact that spine radiosurgery is such an essential part and is still in its early development phase, CNS provides an opportunity to focus on brain and spine, which I think is wonderful. It is also a great time for new to the business physicians and physicists to attend and get their questions answered in a more focused manner. I think that in 2025, it's always been true of medicine, but I think in 2025, especially with the explosion of data, large data sets, AI, if we are not working as an organization to help each other understand how best to serve our patients, the human aspect of medicine can get diluted. We learn so much in speaking with each other, hearing each other's talks. Some of us have heard much of this before, but every time we have that conversation, new ideas come. And I learn most from questions from the audience when someone asks me something that is very basic. I'm actually very excited. So I think these societies serve a great purpose. They standardize the care of medicine. We come out with guidelines which help new programs go the right direction. We also come up with utilization reviews which help us internationally make sure that care is provided to all patients, access is maintained, and reimbursement for the said care is done in a reasonable manner. Well, I'm looking forward to the fact that this is a very rapidly changing field. I think meeting every other year in a focused manner and the alternate year in a more general manner gives us fresh ideas. And some of the things we have done in the CNS world are really applicable to the extracranial radiosurgery universe. So those interactions are just as important as focused discussions within our own disease site. So absolutely look forward to it.